Chairman, thank you. Thank you and Senator Burr for today's hearing. Thank you for the witnesses for being here. Let me start with Dr. Walensky, please. Doctor, in May, the CDC announced new guidance for fully vaccinated individuals that they could resume activities without wearing a mask or staying socially 6 feet apart. At that time, the CDC further said that they would continue to update guidance for travel as the science was developing, and they would need to collaborate with other agencies regarding a face mask requirement. A month later, me and a number of my colleagues sent a letter to the CDC and to TSA asking for an update regarding the mask requirement during travel. While we had a response from TSA, we've not had yet a response from CDC. And I wondered if you would tell me where the CDC is in the process of updating the mask requirement for fully vaccinated individuals while traveling.
Thank you for that question, Senator. Obviously, as you know, the discussion about masking on federal and aviation and ships is an interagency process, not simply with CDC. I will say a lot has changed since May 13th. As you heard from Dr. Fauci, we now have a variant circulating in this country that is, at the time was less than 3% and is now 83% and much more transmissible. So we are continuing those conversations, working toward a letter back to you. Thank you for your patience. And we'll continue to revisit that as we learn more about vaccine efficacy, as we learn more about transmission in the context of vaccination, and as we understand, more about the Delta variant.
Would you expect a change in the expiration date of that continued requirement?
I think we still have more looking to do with that.
Let me turn to Ms. O'Connell. Ms. O'Connell, you're not the perfect witness from HHS for my statements or questions, but you're my only witness from HHS for my statements. It is a bit about the future, which you are fully engaged in. We need a better response to public health emergencies, and I want to talk about, in that regard, I want to talk about the parameters of the Provider Relief Fund. HHS, in my view, was terribly slow in their release of guidance and on how the funds could be utilized. There's been a lot of confusion by healthcare providers. They've been reluctant to spend the money. We're incapable of solving problems if the resources that we provide those who are in the healthcare field, they are not utilized because they're fearful that they don't know what the guidance is, and therefore, if they make a mistake, they'd have penalties at a later date. And so I guess the question that could be for you, what is the plan to get HHS to perform better or more quickly so that providers have the necessary information and comfort level to take the steps necessary to prevent the spread of the virus and to care for the health care of Americans and others? And the part that doesn't necessarily involve you, but in hopes that HHS is otherwise listening, there's about $24 billion left unspent in the Provider Relief Fund. And we've been anxiously awaiting, always with the answer that it's in the works, about assistance and care for facilities that care for our senior populations. And there's still no answer in that regard. So I don't know that you have a comment necessarily on that part of my commentary. But again, I'd utilize this as an opportunity to try to get more certainty at HHS on the spending of those dollars.
Senator Moran, thank you for your question for both parts of it, and I certainly appreciate how frustrating it's probably been not to have the clarity that you and your constituents have been seeking, and we'll take the comments that you've made today and bring them back to the Secretary and other parts of HHS senior leadership to make sure that we understand how important it is that this money is moving quickly and that the guidance comes out expeditiously and that we can do all we can to support. I mean, we really want to do all we can to support your constituents, and so it's helpful to know that this has been a problem, and I look forward to working with you and your staff on it.
If you can accomplish that, the purpose of my commentary will be satisfied. I would particularly ask that someone from HHS respond to us about the Provider Relief Fund as it relates to senior care living circumstances. Dr. Fauci, in the 24 seconds I have left, I'll just ask a quick question. What are the necessary steps? You've talked about mental health. What are the necessary steps to mitigate a mental health and drug overdose crisis? What should Congress and American institutions be doing today for a future pandemic?
Well, first of all, I think the lesson that we've learned from this, and we would hope in good preparation for what will inevitably be another challenge in the future, can't predict when, is to realize the important mental health impact that this outbreak has had, not only in the suffering from the disease itself, but from the extraordinary disruption of our society, which I think we're going to have to realize that even when we get this under control, the mental health effects of this are going to be following this for months, if not years afterwards. We can't forget that. When the outbreak is over, the mental health effects are not going to be over. They're going to linger, and that's what we really need to address.